At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Causes and Treatment for Low Back and Leg Pain on Wednesday, February 18th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome to yours truly, Dr. Tom Roselle, and this is Ageless Health, and we're going to be talking about your aching back today. But we're going to do it from a little different platform. By the way, are you cold enough? Be careful with those snow shovels out there and digging things out. Remember, do it slowly, small pieces, bend your knees, lift straight with your legs, not your back, and you might not get hurt. We've had all kinds of people walk into the office this week that they say, I don't know what I did. It literally bent over where they can't stand up. Not okay. So, let's explore that. Why do some people, have problems on an ongoing basis and others don't? By the way, this is all leading into a program in-house on February the 18th, Wednesday night at 6 p.m. at the Roselle Center in Fairfax, Virginia. Dr. Harlan Browning and I will be co-presenting. We're going to be talking about low back pain and leg pain called sciatica, down the back of your leg, into your toes, and numbness and so forth. Those of you who've heard the professor before know this guy is brilliant. He's amazing in his knowledge base, but we're going to have some fun. We're going to point things out and we'll say, look at that, look at you. How many of you got this, and so forth. But please remember, you have to make a reservation. I also want to remind you of something. Go to the websites, go to either rosellecare.com or drtomroselle.com and go to the Ageless Health store. And you're going to find that we have set something up for you. So those of you who are not patients, that anytime you hear me talk about a nutrient base and so forth, you can actually get it. And all you need to do is go on and check it out. For example, you go to Ageless Health store, and when that opens up, you're going to see something that says full script, and click on that. And these are products that I recommend. There's some in there right now for optimizing your immune system so you don't get all the garbage that's out there right now. And sitting next to it, there's something called Air Tamer. And it has to do with something you can wear over your neck instead of those stupid masks I see everybody wear, and that will knock out the majority, over 90% of all viral patterns, including the craziness we've been, trying to fight off for quite some time, within 20 minutes. I mean, it just knocks it clean, cold, knockout time. So check both of those sites out. Go in and look at them. Full script, you'll see it there. Air Tamer, how you get there. On both sites, whether it's Roselle Care or Dr. Tom Roselle, it's Ageless Health Store. And just click that and run with it. Okay, let's get back into the program. I've got a lot to tell you about today, and unfortunately, as always, not as much time as I'd love to have, but that's the way it is. But you'll get the rest of that on February 18th. So chronic pain often is a result of ongoing, chronic, very heavily laden inflammation. And the evidence that finger points that way is very strong. And it says your diet, your exposures, your environmental impact dramatically increases your whole body, called systemic inflammatory reaction. But what do we do about it? How do we know, do we just take a handful of pills, or do we shift and change our exposures? You start with the trigger. The trigger is the stuff that you shove in your face and that you expose yourself to on an ongoing basis. So health and wellness is something that we have to take into consideration. This more than anything else, is very specifically a do-it-yourself issue. So we're talking about your back pain. So let's start with inflammatory reactions. And remember, when I say inflammation, we're talking what? Acid. Acid burns. Acid causes things to break down. It causes things to degrade. It goes into pathology. So inflammation is, by the way, a natural response to any kind of injury or infection. But when it becomes chronic, when it just doesn't go away, it's not about taking an anti-inflammatory all the time. Those are good to break a cycle, but it contributes to the development of ongoing chronic conditions like your low back pain. Look, low back pain generally starts more than not from a distortion in the spinal system. Bones in your spine called vertebrae move out of position because of muscle imbalance, because you've got too much around your waistline, because your posture pattern's terrible, because you don't get up, for anything except to go to the bathroom, and the only exercise you get is a remote control. Did you hear me? How many of you say, yeah, I do that? How about if you get in the car, go to work, get out of your car, just go to your desk, get back in the car, go back home, and don't do anything in between? That's called structural injury because you're not using your body the way it was meant. You don't stretch, you don't even tighten your belly up. When you're sitting around watching, you just kind of let it sit there limp and loose. Now, nutrition that supports the reduction of inflammation may significantly decrease the frequency and severity of that back pain. And let me tell you something about back pain. The statistics are this, that over 90% of you, like 91, 92% of you, will have some type of back pain in your life. Isn't that ridiculous? You shouldn't. You shouldn't have that type of problem. Now, are you going to sit there and just say, I got to go to the doc and I got to get a painkiller. I'm going to be put on all these narcotics and so forth. And so pretty soon you get dumbed down that you don't do anything else and you make it worse. But here's the deal. If you have a diet that is loaded with seed oils and carbohydrates and so forth, they significantly can increase the inflammatory reaction. But if you have a diet that has a lot of vegetables in it and drinking a lot of water, you'll add to that decrease. So let's talk about things that decrease and increase. All right. So foods that are most often associated with high levels of inflammation that'll give you headaches as well, but your back pain, it makes it hurt because why? Because it's swelling. Is anything that's processed. Remember my mantra, avoid sugars, sodas, black teas, coffee, and so forth, sugar, sodas, caffeine products, alcohol, gluten, additives, GMO products. You say, yeah, what else do I have to eat? Nothing, right? Well, there's a lot of things you should be eating. How about sugary foods? Anything that has sugar in it will cause inflammatory response and also that extra 30, 40 pounds, 10 pounds that you have around your waistline, which dramatically increases your risk for low back pain. How about trans fats? Now, we're not talking about saturated fats. We're not talking about monosaccharides. We're talking about trans fats. They're generally found in things like foods that are processed, and they significantly trigger the inflammatory cascade. So, look, here's the deal. How about your fryer? Fried foods, they contain high levels of all kinds of unhealthy fats, and they can contribute to inflammatory reaction. Yeah, and guess what? Your microwave, by the way, how you just throw it in, don't think it changes the component, changes the structure of your food. I know, I'm taking everything away, right? Now what do? Well, you're going to learn how to eat well. That's why you're going to come on the 18th at the Roselle Center for Healing, and we're going to give you guidelines. Deficiencies in nutrition. What kind of deficiencies am I talking about? I'm talking about you're not getting enough calcium, you're not getting enough vitamin D, you're not getting, you dramatically increase your risk of injury and the solidness of the ligament structure and the muscle structure and the bone structure. You can have pain because you're going into osteoporosis. Not just you ladies, guys, pay attention. Because if you can, if you're not doing what you're supposed to be doing, if you're not moving around, if you got too much around the body, you're not eating the way you're supposed to be eating, you're not getting the nutrient bases. And in this area, 78% of you have low levels of vitamin D, and it's not based on the stupid laboratory levels that tell you that if you're at 30 to 100, you're good. If you're over 50, you might begin to get good. But if you're under 50, you are predisposed to all kinds of things, but you have to pair that up with other components as well. And blood studies will show that if your doc knows how to interpret them and not just look at the parameters. How about magnesium? Most of you are deficient in magnesium as well. And that's where you get the cramping, you get the stiffness, you have no flexibility. A deficiency in magnesium can lead to muscle spasm and inflexibility of the tendons, and they can contribute or cause that. How about B12? Yeah, well, you said, well, I have B12. That thing that's called cyanocobalamin that's in your multiple vitamin, that B12 doesn't absorb very well, by the way. And if you have to be an MTHFR genetic, person, it means you got a glitch in that pathway. You're not absorbing it unless it's the methyl form. And that's a whole different thing. But you need it for nerve root function. And guess what the favorite nutrition is for fascia? The covering that allows the muscles to stay intact and so forth. B12 and folate. And so if you have low levels of B12 and folate, it can lead to nerve damage and pain, including low back pain. And guess what? That leg pain, that thing that we call what? Sciatica. And by the way, if it goes down the front of your leg, it's not sciatica. That's femoral pain. If it goes down the back of your leg, that's a sciatica. Now, look, calcium is important for building bones. And a deficiency can lead to, as we said earlier, weakened bones because of osteoporosis and osteopenia. Osteopenia is not quite as severe, but you're still losing calcium. And the other piece is iron. Did you know that iron is the reason that you can transport oxygen into the tissue, but a deficiency can lead to anemia? And that anemia has been shown to cause muscle weakness and subsequently what? Low back pain. Yep. Guess how many of you are messed up? And then what happens if you don't do what you need to do is it becomes progressively worse over a period of time. And you don't know why it's happening. And then you lose your normal curves in your back. You're bent over. Now you have bones that are moving out of position, and those bones that are causing the nerves to be either stretched or compressed, and it does it through other surrounding tissue. Now you're in trouble. Now you got a major, major thing on, your plate. So wouldn't it be great to know this ahead of time and being able to do something about it? So what can you do? Maybe add a little bit of cod liver oil, some salmon from Norwegian salmon, not farm raised, a little bit of sardines, a little bit of free range organic grass fed beef, and so forth. Those things are really good for your body. Now let's talk about the piece that's, you get finger pointed on and everybody's selling GLP, ones and so forth, all these weight reduction drugs that are out there that cause cancers. Yeah, you heard me. They can cause cancer. So if you're putting that garbage in your body, you're increasing your risk of all kinds of other things. But fatness, obesity is a major epidemic. And here's the deal. It currently affects 4 out of 10 Americans. That means 40% of us are too big. And we need to do something about it. Weight and overall health targets are always connected. Obesity, too much weight on you, is often considered the cause of several chronic diseases, including what? Some forms of cancer, diabetes, low back pain, and so forth. And those have their other spin-offs in addition to that. So look, if that's the case, and we really truly want to take control of our lives, you don't need a drug that can cause other serious problems. You need a plan. You need to get your HPA axis, hypothalamus pituitary adrenal system, working the way it's supposed to. You need to get your pancreas to produce the enzymes it's supposed to be producing, things like protease and amylase and so forth. There's many others. And get it done. Go for a walk. Get off your butt. Go down the street. Walk down 15 minutes down one way, 15 minutes the other way. I said walk easily. I didn't tell you to run. I didn't tell you even to walk fast to start with. Just go for a walk. Do a little stretching. Do the things that you're supposed to be doing. And maybe, you get a little tougher, a little stronger, and your back pain is going to go away. So, but being a little heavier than you should be, some of us are a whole lot heavier than we should be, puts extra strain and pull on your back. And that all by itself can cause nociception, which means pain receptors to trigger your brain and say, I'm in trouble. So, between the increased pressure and then, the misalignment that we talked about and the reduced flexibility and, the degeneration that occurs, the spinal stenosis because of that, all of those things cause your back pain never to go away. It's always there. You're always looking for something to dumb it down because you think that it's outside of you. You think it's something besides your decisions. Well, I'm here to tell you that is. And you want me to give you the number one cause of joint breakdown, particularly in the low back and other joints as well. Number one cause? Dehydration. Most of you don't drink water. And if you do drink water, you're not drinking enough. Here's the deal. Your discs, those little cushions in between the bones of your back, they're made up of the inner spaces of 75% water. And it's not just fluid, it's water. So, well, yeah, I drink tea and I drink coffee and I drink juices. And so that's not water. Water is primary. And I ask, oh, how much water do you drink a day? Well, I drink a lot of water. Quantitatively, how much water do you drink? If you're not drinking at least, the rule is what? Half of your body weight in ounces every day. If you get close to 80% of that. So let's say that you're a 180-pound guy. And at 180 pounds, half of that's 90 ounces. And if you get 80% of that 90 ounces, you got 72 ounces. So that's your target, just water. Add a little salt to it, a little Himalayan salt, a little Celtic salt, a little Baja Gold to it, not table salt. That's not good for you. That give you problems. But if you do those other things, you will be amazed, my friends, on how your life will begin to turn around. Just doing that, and get up and walk, go do some stuff. I'm giving you things. So we want to increase our flexibility. We want to we want to decrease the risk of muscle strain by doing what? Water and magnesium and things like B12, right? We want to increase our blood flow to tissue. And again, just go for a walk. We want to decrease the inflammatory response. That means quit eating junk. Start eating real food, good stuff, good for you things. And not just pounding proteins that are meats and so forth. We want that stretching to occur. Ladies, look, if you have back pain and you're still menstrual, I can promise you your periods are going to be horrible. Guys, if you have a low back pain problem, I'm going to guarantee you if it goes long enough, guess what else is not going to work? It's called your friend. You're going to suffer erectile dysfunction. Years ago, I had a patient when I was an intern, and this guy was having all kinds of problems with his low back. And I noticed that he was sitting on a wallet that literally was about 2 inches thick. And I said, hey, man, where'd that come from? He said, oh, that's my filing cabinet. He was a long haul truck driver. And I said, do you sit on that? He said, yeah, it's always in my pocket. I said, okay. I said, do me a favor. I said, we just got treated. Take that thing out of your pocket, put it in the truck in the cab someplace, but don't sit on it. He came back about a week later because I was in Chicago. He was going down to St. Louis and then back. He said, Doc, I don't know what you did. I said, no, you did it. You took that stupid wallet out that was causing a problem that was sitting on the nerve called your sciatic nerve and causing you some other problems called back pain. And he just looked at me. He said, you're kidding me. I said, no, that's why, you'd feel good after you got treated, but that was it. When you're dealing with bowel problems, intestinal tract problems, irritable bowel disease, colitis problems, things of that nature, if you don't have good probacteria in your system, your inflammation can go through the ceiling and lead to significant amount of low back pain. I don't know about you, but it's not the way I want to live. So when we look at the different ways that we can help our gut, eating well, right? Decrease the inflammation. By the way, if you know you have some issues, I'm going to give you something you can do. You can go get that off of Ageless Health website and go into the nutraceutical firm that we set up there for you. Here's how you do it. Go find something called Intenzyme Forte. It's from Biotics Laboratories. Intenzyme Forte from Biotics Laboratory. And they're little tablets. Now, first thing you do in the morning, I want you to take about 4 of them and they're not going to get hurt, and you take them on an empty stomach. Then maybe, an hour before you have lunch, take another 4. And then an hour before you go to bed, take another 4 and see what happens. It's not going to hurt you. So these are little things that can decrease inflammatory reaction within the body, as long as you don't take them with food. If you take them with food, they become a digestive enzyme. But if you take them alone, they decrease inflammatory reactions within the body. Now, if you know you hurt yourself, and you've been dealing with back pain, it's never gone away, that's when you pick up the phone and you call the Roselle Center for Healing, and you come talk to us and we'll get it done, right? So here's the other thing that you're going to do. You're going to come and join us on the 18th of this month. Dr. Harlan Browning and I, we're going to go back and forth and teach you about leg pain and back pain. We're going to teach you things that you can do for yourself. All you got to do is go to rosellcare.com, rosellcare.com, and join us. I promise you, you're going to walk away with tools that will allow you to live better than you are right now. Wouldn't you like to get back to you, being able to do the things that you'd like to do? That's my goal on a day-to-day basis. I start my day getting up and I have a little, conversation with my creator. And then I sit there and I focus on my day. And then, so here's the deal. You can reverse this if you want to. Join us on the 18th, register for it, and show up. Make sure you come. And if you can't make it, let us know you can't make it about a day before, okay? So we can invite somebody else. But I promise you, you don't have to live with back pain. You don't have to live with problems. We're coming up to the end of the program, and I wish I had all day just to sit here and talk to you on an ongoing basis. Remember, I'm here every week, bringing you different types of formats in your health and your wellness, your ageless health. One reason only. You deserve it, but I love you all. You have a great Sunday. I'll see you soon. Bye.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Causes and Treatment for Low Back and Leg Pain on Wednesday, February 18th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.
There's two kinds of love in this world. There's the kind you want and the kind you need. But everybody has the capacity to be kinder to one another. live a better way. It feels like heaven to be alive, to be alive. It feels like heaven tonight. There's always a certain danger in learning to love a stranger. But faith teaches every man to strive for the best you can. It should feel like heaven to make another's day. It should feel like heaven to live a better way. It feels like heaven to be alive, to be alive. It feels like heaven tonight. If you don't know anymore to believe, and you can't count anymore all the times you've been deceived, if you're searching for something to call your own, but nothing comes to mind and no place feels like home, you've got to see it for yourself. It takes time to understand. You're only gonna make it if you take another's hand. If you see a child smile or read a letter that sheds a tear, that's what you remember, and that's why you are here, 'cause you are loved. It should feel like heaven to make another's day. It should feel like heaven to live a better way. It feels like heaven to be alive, to be alive.